And a very pleasant good afternoon, ladies and gentlemen. Chris Babcock coming to you live from here in the heart of the high desert, right along Restaurant Row with our friends here at El Paso Physical Therapy Services, of course, their Horizon location. And I am joined by...
Clarissa Gantz.
And Clarissa is here to show us again, as we continue our series, about physical therapy and the different modes of which you can come in and take advantage of their services and how it will help you in your daily life. So Clarissa, talk a little bit what we're going to go through today.
Thanks, Chris. So today we're going to talk about proper body mechanics when lifting. And this is really important this time of year with Turkey Day this week, lifting a heavy turkey, getting your decorations out for the holidays. People are lifting really improperly a lot, I see. So we're going to talk about how to lift things properly without injuring your back.
I'll tell you what, after yesterday's garage incident and me waking up with a stiff neck, I could have probably used this a little bit earlier, so we maybe should have done it. But for everybody else, I'll tell you, man, we've got 3 or 4 of these gray bins at our house, and they are quite heavy. You don't realize how heavy they are until you actually go after it.
Exactly.
Okay, so who's going to be our helper today?
We've got Miss Maria right here. She's going to come in and kind of demonstrate for us.
Okay.
So first I'm going to kind of show you what I see commonly. It's like the incorrect way to lift. So what you see a lot of times people arch their back. They'll bend over to grab a box. I'll be holding it for a second. Thank you. They'll grab a box, kind of lifting like that, arching their back like that. We don't want that. I see people at the grocery store doing this all around. I see family and friends do it every once in a while. So we're going to show you. I'm going to have Maria come in here and show us the correct way to do it. So what she's going to do, she's going to use her hips and her legs, not use her back during this. And so I'm going to have her put this little cane behind her back as a little cue. This is something you can do at home. And what you can do at home, if you don't have a cane, you can use a broomstick. Anything that's a long stick that will not move. So I'm going to have her kind of turn so you can see that. I'll have you kind of show you where you're holding it right here. We have 3 points of contact we want to keep. We want to keep the head between the shoulder blades and the spine and the tailbone. And so I want her to keep those contact points at all times to not let it move, okay? So I'm going to return to the left again. So she's going to do, I'm going to have her do what's called a hip hinge. So she's going to push her hips back and bring her trunk down to show a proper lifting technique, okay? I'm going to do that nice and slow for you. So notice right there, the cane is not coming off her tailbone, her back, or her head. It's keeping contact in all 3 of those points right there. She's coming up. Perfect. That's how you're supposed to be lifting. So I'm going to have her do it one more time. I'm going to have her do it the incorrect way right here. What I commonly see is this cane starts to come up right there. That's the most common point I assume people are trying this for the first time. You want that to keep it down. So bring it down. Good. We're going to do it one more time. We're going to do it the correct way. So we're going to have it all 3 points of contact kept on there. She's going to bend down. Make sure she keeps her head in alignment as well. I often see people lifting. They'll keep their head up like this, especially at the gym. You see people doing that, and they're trying to watch their form in the mirror when, in fact, they're actually straining their neck. So this will help decrease the pressure in the back and decrease your risk of injury when lifting things. And so we commonly do this in the clinic a lot of times with patients to practice that proper body lifting mechanics. And so after we get this down, so after a few sessions, I'm going to have her take that out. We're going to load it now, so we're going to apply some weight. So let's say you're lifting boxes for the holidays or lifting that turkey like I said this week. So we're going to have Maria come over here and lift these boxes of Christmas decorations we've got.
And again, this is just nothing but repetition, right? This is just, you've kind of learned it or you've just started doing it. It's just learning how to do it the correct way.
Exactly. It's retraining your body to do that proper technique. And like you said, Chris, once you do it so many times, it just becomes natural. You don't have to think about it. You won't catch yourself bending. You'll just naturally start pushing those hips back and realize, okay, this is how it's supposed to feel. And Maria can attest it feels very different than using your back when you do this technique. So I'm going to have her get these boxes. She's going to lift from the bottom box, lift both of these boxes. So she's bringing that hip back. Good, and bring it up. Good, and she's going to bring these boxes onto right here. So it's kind of like lifting groceries into your backseat of your car. I see people, they'll do the bend on the back, and then they'll throw things in the back of the trunk and twist their spine too, and we don't want to see that too. So she did a really good job at lifting it up and walking forward. The other thing I want to point out, I want to have her grab the boxes one more time. So say she's trying to move the boxes over to this table over here, to the back seat of her car. See, she's pivoting with her feet. And she's keeping the boxes close to her body at all times. Oftentimes people will be holding things and they'll have it really far away from their center of mass when they're moving like this. And that puts your shoulders at risk for shoulder injury as well. So keeping the boxes you're lifting or anything you're lifting close to your body, moving your feet with it, and then say she's pushing this in the back seat of her car. Instead of lifting it to the back seat of the car, the spot she wants, she can simply push the boxes just like that.
And one of the other things is that she didn't twist. She actually pivoted, because a lot of people would just take that and turn on their back, and really that's a lot of stress on the lower back.
Oh, it completely is. And a little way to remember that is BLT. Is a good way to remember it. Bending, lifting, and twisting all together. That's kind of a good way to remind everyone not to do that. The bending of the back, lifting something heavy, and then twisting. Just like you said.
Yeah, I can't tell you how many times I've actually done that incorrectly, and yeah, you do feel it the next day. If you're lucky, you'll feel it the next day. If you're unlucky, it'll hurt you right there and then.
Exactly. And like you said, just retraining the body to do that correct motion. And that motion is really important. In fact, there's studies that show that you do that bending motion 3,500 times per day, the average person. So imagine if you're doing that 3,500 times a day incorrectly, what it's doing to your spine and everything else there. So
and that's just a regular person. If you're not working, let's say, for UPS or maybe even over at some of the stores, if you're doing that just in your regular time, imagine how much more you're doing it. And that simple training with that hard point from the 3 points of touching will make all the difference in the world.
Exactly, because when you think about it, like that 3,500 actually makes sense when you're going to the restroom every day. You're sitting up and down from the toilet. You're getting up and down from a chair at work. Maybe you have a desk job. You're still getting up and down, getting out of your car, picking up the kiddos, picking up your dogs. Like, you're constantly doing that, tying your shoes. Like, there's just a ton of ways you're doing that throughout the day. So it's really important to get that down.
And again, with this practice, how often would you do it just to get into the mode of learning the correct lift?
I'd say if people can, a couple times a week, I'd say, and do it for a few minutes at a time. Don't just do a few and call it good. I'd say, especially if you know you're going to be lifting a lot, definitely do it before if you have time to do that. Say you have a friend you're helping them move this weekend, for instance. You know you're going to be lifting a lot of boxes and probably having bad form and twisting and turning. You don't want to be aching the next day, like you said, like people often are when they help someone move. So I'd say definitely practice for a few minutes at a time just doing that. And you can even, any age can really do this motion. I have seasoned athletes come in here that still don't do it correctly. I have them do that with the cane. And that bottom part comes up, and they do a ton of squats, deadlifts, motions like that in the gym, and they still need to learn that hip hinge.
Yeah, I think one of the points that you did make earlier was that people think, I got to watch my form. That's the simplest correction to make right there.
Exactly. And I say, like, with that neck position, like I mentioned earlier, people extend the neck up when they do lifting techniques like this. You can watch yourself in a mirror. Like, they try to watch themselves in a mirror, but just use your eyes. Don't use your head. So if you're bending down and you want to see how you're doing, you can use your eye to kind of look up or look forward. But just keep the head in alignment, though, throughout that process. So
a very, very busy holiday season coming up, and a very great tip, especially, like you said, those 25-pound turkeys that you might be serving. Yeah. And again, right after you pull the turkey out, it's time to pull down the decorations. Last word for you for your clients and some potential people out here. How do they get a hold of you to go through this training?
Well, like I said, I'm located at the Horizon Clinic. We also have one at the west side of town and also the east side of town, too. So if you want to see me or any of the other therapists, we're all happy to help you and assess your body mechanics. Say like you said, you were lifting yesterday and you just want to come and you say, I think something's off. I want to get it kind of looked at by somebody else. Then we can definitely do that for you. And I say, don't hesitate to go to your doctor and get a referral to come see us out here, and we can get you checked out.
Well, that's pretty much the life for now. I think I'm going to have myself checked out right now. If you want to see their correct technique and get all the information, we'll have it right underneath this video in just a bit. But for now, Chris Babcock saying, have a good day, everybody.